am Brian Samuels, the Executive Director at Chapin Hall. We're a research and policy center, really supporting evidence-based policy making. Today's webinar on economic and concrete services supports furthers our commitment to, one, expanding the use of research in child and family policy making, two, to identify policy solutions that achieve equity and promote the well-being of families of color, and three, to promote policies that are responsive to what families say they need. Now, we think that there is a strong body of research that shows that policies that meet the basic needs of families are also associated with reductions in child welfare involvement. We're going to share some of that research with you today, as well as some of the policies. When I was a child welfare director for the state of Illinois a long time ago, this information would have been really helpful in helping me to educate, partner, and collaborate with other systems or my other system colleagues. They would have provided more actionable policies for strengthening families and preventing bad outcomes. Said differently, this information would have been really useful in helping me craft the kinds of policies that meet the needs of all families. We hope that the evidence we present to you today is as compelling to you as it is to us, and hope that you learn something that you can take back to your state, to your locality, to your partners, as a vehicle for promoting further change and systems transformation. With that, I'd like to turn the conversation over to Clare Anderson.
Thanks so much, Brian. It's a pleasure to be here. I'm Clare Anderson. I'm a senior policy fellow here at Chapin Hall, and my colleague Yasmin Grewal-Kok and I will be talking with you today about a child and family well-being system, economic and concrete supports as a core component, particularly as it relates to reducing risk for involvement with child welfare systems. I'd also like to thank my colleagues at Chapin Hall who've contributed to this body of work, and certainly to the researchers across the country who've been building a body of science and evidence over the last 20 years that we're going to be reviewing today. So we'll start by talking a little bit about the historical and contemporary policy context that involves our macroeconomic policies, our public benefit policies, and our child welfare policies that created kind of a combination of factors, including economic hardship in the lives of families, a fragmented human service system with often deficit-based or rigid and bifurcated policies, whereby policies designed to support the resource needs of families are separated historically from the policies designed to address child safety, alongside mandated reporting laws, plus really a disparate access to or lack of sufficient economic and concrete supports that contribute to families becoming overloaded or destabilized with unmet service needs and high rates of reported neglect. That leads to, we think, the deployment then of the government's truly among its most intrusive and punitive authority to investigate families and to remove children from their homes, and then long-standing child welfare system involvement. This historical policy context really centers the individual as the locus of responsibility. And our interventions are designed primarily to address a perceived limitation or a pathology in a family. And I think the evidence that we'll present today suggests that our broader policy framework and the resources available to families requires our equal attention for intervention and resourcing. And so today we'll toggle between that evidence and examples of policy choices that states or systems can make that might ameliorate or limit the involvement that families have with child welfare. So we'll start by talking about the intersection of family economic insecurity, income, and involvement with child welfare. We know that about 60% of substantiated CPS responses nationally involve neglect only. And we also know that neglect is quite complex, and it includes often substance abuse, mental health concerns, or needs in the lives of families. But the evidence suggests that economic and concrete supports are having an effect on neglect, inclusive of those complexities. And we also will see that the provision of economic and concrete supports is associated with a decrease in risk for both neglect and physical abuse. So toggling then to state policy options that we're beginning to see across the country in Washington state, there's a tightening of legal standards for the removal of children from their home. In Washington, this prevents the removal of children solely due to community or family poverty, inadequate housing, mental illness, or substance use. In Kentucky, we see, in addition to narrowing the definition of neglect, also adding that families must be able to financially ameliorate or be offered financial or other means to ameliorate the risk. In Montana, we're seeing an interesting proposal that includes expanding reasonable efforts required to prevent removal of children from their home, including identifying community resources and actively assisting families to access those resources. In Vermont, another policy option we see is an economic diversion system designed to address poverty-related neglect. There's an economic firewall that requires interagency collaboration and service coordination with the co-location of economic services and early childhood development division. We see providing family preservation flexible funds and a multidimensional diversion system. This is important because we know that nearly 85% of families investigated by Child Protective Services earn below 200% of the federal poverty line. We're also increasingly understanding that income is one important component, and material hardship, particularly as defined by inability to pay for housing, food, medical care, increases risk for child welfare system involvement. In this study, a longitudinal study of families receiving TANF, temporary assistance to needy families, those who experienced one material hardship or at least one material hardship had a higher likelihood of a neglect investigation, but even higher likelihood of a physical abuse investigation. And families that experienced multiple types of material hardship after experiencing no hardships had a higher likelihood of a CPS investigation, neglect, or abuse, but an even higher likelihood of a physical abuse investigation. So this is beginning, this study, the Yang study, and a few additional studies are helping us to understand predictors of involvement with child welfare systems, which helps us begin to know what to look for upstream of child welfare in other systems to begin to ameliorate risk or resource families in ways that reduces their risk for involvement in child welfare. We see on the right-hand side of the slide in the darker blue that the strongest predictors of investigated neglect reports include food pantry use and cutting of meals, so food insecurity, housing insecurity, including difficulty paying rent, inability to receive medical care for a sick family member. And we also see public benefit receipt as a predictor of an investigated neglect report. But we will see throughout the presentation today that public benefit receipt can be incredibly protective and buffer families from involvement with child welfare. So we have a few hypotheses here that this might include perhaps insufficient benefit receipt or perhaps increased surveillance in other systems. On the left-hand side of the slide, we see that the most reliable economic predictors of child welfare system involvement in this systematic analysis showed income loss, cumulative material hardship, and housing hardship. So we're beginning to have much more nuanced information about the ways in which families are experienced increasing risk of involvement with child welfare systems. Additionally, we're understanding that negative earning shocks in families, as defined in this study as a quarterly reduction in earnings of 30% or more, increases the risk of a CPS investigation or a subsequent CPS investigation after a recently closed CPS investigation. But the increased risk of a physical abuse investigation is even higher. So we also see here that each additional negative earning income shock is associated with about a 15% greater likelihood of CPS involvement. Again, we see some protective nature of stable income or less volatility, whereby each consecutive quarter with stable income is associated with a 5% lower risk of CPS involvement. And as I noted earlier, public benefits can be protective. In this same study, we see that the low-income families with the recently closed CPS investigation who were able to access sufficient public benefits when their negative earning shock occurred in their lives, that this was effectively buffered against the risk of child welfare involvement. And this was particularly strong for families with a young child between the ages of 0 to 4. So we see an associated with a 12% decrease risk for CPS involvement and a 50% decrease in risk for physical abuse investigation. So again, this involves not just neglect, but also physical abuse when we see the sufficient availability of public benefits or income or concrete supports in the lives of families. In looking at earning shocks or income shocks from a different vantage point, we see that when the unemployment rate increases, we see associated increases in child abuse or involvement in child welfare. In this study that looked at the rate of abusive head trauma, it found that abusive head trauma for children under the age of 5 was significantly higher during the Great Recession between 2007 and 2009 as compared to the period immediately before. So we see the abusive head trauma rate increasing from 8.9 per 100,000 children before the recession to 14.7 per 100,000 children during the recession. Interestingly, we're beginning to see evidence of a possible causal effect of income on risk for child welfare system involvement. This randomized controlled trial looked at mothers who were participating in TANF and were eligible to receive full child support for their children. In other words, the state did not take an administrative fee in child support, and that money was passed directly to the mother. There was a 10% less likelihood of having a child subject to a screened-in maltreatment report, and even a modest increase in child support, averaging about $100 per year, results in a decrease in a screened-in maltreatment report. So we've been talking thus far mostly about the prevention side, what happens before families are involved with child welfare or their risk of becoming involved with child welfare. But we also see that once children are in foster care, that a lower family income is associated with a longer time to reunification. And we see that families who have a lower average monthly income post-placement have a longer time to reunification. Families who lose a significant amount of cash assistance post-placement have a longer time to reunify, and families who must pay the state for the cost of foster care. In this study, predicted the time to reunification to be delayed by 6.6 months. So toggling then to a state policy option, you see here, California continuing cash assistance for families that are working to reunify. This piece of legislation that became effective in 2021 requires that parents who are receiving temporary assistance to needy families and who are actively working to reunify when their children are placed into foster care continue to be eligible to receive monthly cash assistance for up to 6 months. So making actionable the evidence and the research that informs their policy decision-making. We'll talk mostly about state policy options and examples today, but relative to the Kansian study and the California policy decision, we see recent federal guidance recommending to states that they limit the billing of parents for the cost of foster care. In June of this year, ACF issued joint policy guidance clarifying that child welfare agencies are not required to, and encouraging them to stop billing parents for the cost of foster care. And they state it's likely that reducing the income of the child's parents could impede the parent's ability to engage in reunification efforts, potentially extending the time that a child spends in foster care. Okay, so let's shift a little bit and zoom out and talk about context and the context of family economic insecurity, income, and child welfare involvement. We know that economic insecurity is widespread, but families do move in and out of poverty. Almost 50% of those who become poor are out of poverty a year later. But more than 50% of those who previously left poverty likely return to poverty within 5 years. And so based on what we know about moving in and out of poverty and economic insecurity, and this broad body of evidence that we're sharing with you today, and we think that this volatility and turbulence, particularly at the edge of scarcity, is creating serious stress for parents and is likely impacting parenting, thereby creating additional risks for their involvement with child welfare. This study showed that income instability significantly increases risk for child welfare system involvement. And low-income families at risk for child welfare involvement who've experienced income instability in the last year, including changes in both earnings and public benefits, are at increased risk for CPS investigations, even after controlling for household income level, suggesting a unique relationship between income instability and child welfare system involvement. So we think what's happening is that families are becoming overloaded, much like this truck metaphor that many are beginning to use, that when more payload is placed on the bed of the truck beyond a capacity, it no longer functions as it's designed, much like when families have additional stressors or economic instability and material hardship in their life. So these are the same risk factors that we saw in earlier studies being represented here as stressing their ability to operate as designed or optimally. But in addition to thinking about this at the family level or the individual level, it is incredibly important to think about the macroeconomic and public benefit policy context that sits outside of child welfare. This is the World Health Organization's conceptual framework for social determinants of health. does not speak specifically to child welfare system involvement, but we know that many of the social determinants of health are quite similar to the risk factors that we've been talking about here as it relates to child welfare system involvement. And this quote in its framework jumped out at us as incredibly important and germane to this conversation. The single most significant lesson of this conceptual framework is that interventions and policies to reduce health inequities at the individual level are not sufficient. We must also include policies specifically crafted to tackle the underlying structural determinants that we see in the left-hand side of this logic model, that include our macroeconomic policies, our social policies, and our public policies. And this new analysis helps us to understand this more macroeconomic policy context. This forthcoming analysis takes the National Academy of Sciences consensus report, its roadmap to reduce child poverty from 2019, and analyzes a simulation of the effects of increased income on CPS involvement for 3 of the policy packages. This analysis found that the packages have the potential to reduce annual CPS investigations by between 11 to 20%. And the reductions were particularly large for Black and Latinx children and those living with single parents. And the results suggest a substantial reduction in racial disproportionality and CPS involvement is possible, from 19 to a 29% reduction in investigations for Black children, 13 to 24% reduction for investigations in Latinx children. We also do hear often when we talk about policies that resource families, a concern that families may not spend those economic and concrete support resources as intended by the policy. There is a pretty extensive body of evidence suggesting how people spend unconditional cash payments on meeting basic needs, food, rent, utilities, many of those material hardships that we named earlier, on education needs such as tuition and childcare, and paying down debt. We have a few studies that show us that unconditional cash transfer recipients spend less than 1% of their payments on tobacco and alcohol. And a Canadian study, child benefit payments significantly decreased alcohol and tobacco spending in those families. So let's talk about economic and concrete supports as a specific race equity strategy to address disparity and disproportionality in child welfare. Contextually, we understand that poverty and economic hardship puts families at increased risk of child welfare system involvement. And due to longstanding and systemic inequities, families of color are more likely to experience economic hardship and volatility in income and employment. And this may contribute to their disproportionate child welfare system involvement. And economic and concrete supports to stabilize families and prevent child welfare involvement may be a key mechanism to reducing racial disproportionality and disparities. When we look at the macroeconomic context for families of color, we understand that the racial wealth gap is significant. White families hold a median net worth of about $190,000 in comparison to Black families, where that median net worth is about $24,000 and about $36,000 for Hispanic families. So the buffer or the amount of wealth to rely on to even out that volatility or to buffer against economic shocks, negative earning, or material hardship is much reduced relative to white families. And we know that the median wealth of a young Black family is about $600. So when we take this from a cumulative view, or we think about the various policies that we are deploying, we understand that CPS investigations are pervasive. Over half of all Black children experience an investigation during their childhood between birth and age 18. Again, about 53% of all Black children experience a CPS investigation, 37% of all children, and 41% of children in the 20 most populous counties experience at least one CPS investigation by age 18. So determining or making policy choices about which policies to deploy. At the moment, this is a deployment of the CPS investigation at a relatively high rate. And the evidence that we present today suggests that there may be macroeconomic or public benefit policies that we could be deploying more generously, more accessibly upstream of child welfare that might ameliorate or reduce this extensive use of CPS investigations. So I'm going to turn it over to my colleague, Yasmin Grewal-Kok, to walk us through the evidence of the relationship between economic and concrete supports and child welfare system involvement.
Thanks, Claire. I want to talk briefly about the sources of evidence included in our presentation today. We have to be careful about making generalized interpretations from this body of science, since each of the studies we cite have different limitations. There are only a handful of studies we cite today that are randomized controlled trials, which are considered the gold standard of research because they can assess the causal impact of interventions. In this type of study, participants are randomly assigned to either an experimental group that receives the intervention or to a control group that does not receive the intervention. There are limited randomized controlled trials in the child welfare space because ethical issues and practical considerations often preclude experimental testing on this population. So, most of the research we'll discuss today demonstrates associations and correlations, but not a causal impact. This means that several other factors may play a role in the result. Some of the studies in our presentation are based on observations using decades of administrative data aligned with policy shifts. Others are based on natural experiments that assess public benefit programs when there were changes in policies, such as stricter requirements for TANF eligibility or the expansion of healthcare through the Affordable Care Act. The studies we'll share today shouldn't be considered in isolation. Rather, taken together, we think this vast body of science and growing preponderance of evidence expands our understanding of what has been effective and why, and informs potential policy shifts and new pathways. Next slide. So what does the evidence suggest happens when economic and concrete supports are reduced? I like to start with just a brief level setting of what we consider to be economic and concrete supports. This is not an exhaustive list on the slide, but we consider economic and concrete supports broadly to include things like cash assistance, the earned income tax credit, employment, income, SNAP benefits, housing supports, childcare, and Medicaid. Let's go to the next slide. Based on the research we've compiled, this slide provides an overview of the types of economic and concrete supports that, when reduced, are associated with increased risk for child welfare involvement. This includes reduced TANF benefits, lack of childcare and stable housing, reduced employment and income, and also increased gas prices, which translate into less disposable income for families. I won't be able to talk about all of these studies today, so I'll focus on some key findings. This study examined the effect of TANF policy changes and benefit restrictions from 2004 to 2015 on child welfare involvement. It found that states that imposed the sanction of loss of all benefits for not meeting TANF work requirements saw a 23% increase in substantiated neglect reports, a 13% increase in foster care entries due to neglect, and about a 13% increase in total foster care entries. As one considers this, it's important to keep in mind the first statutory goal of TANF, which you'll see in that box on the right, and that is to support needy families so children can remain safely at home. Let's go to the next slide. States have considerable flexibility in their TANF state policy options. And one option to consider is not taking away TANF benefits from the entire family if a parent does not meet the work requirements, which is known as full family sanctions. As of 2021, nearly half of states took away TANF benefits from the entire family as the initial punishment if a parent did not meet work requirements. I also want to highlight that states with higher concentrations of Black residents have a higher likelihood of imposing full family sanction. There's quite a bit of research on the relationship between access to childcare and child welfare involvement. The study in the top bullet here found that for every childcare concern reported by families receiving TANF, the risk of supervisory neglect increases by 20%. Child care concerns in this study included the quality of care available, the cost of care, and difficulty finding care during work hours. The study on the bottom of this slide found that mothers entering substance use treatment who have difficulty securing childcare are 82% more likely to self-report child neglect compared to mothers entering treatment who don't have difficulty securing childcare. It's particularly interesting that difficulty finding childcare was a stronger predictor of maternal neglect than almost any other factor measured in this study, including mental health and severity of drug use. Although most families involved in the child welfare system are renters and not homeowners, this study shed light on how economic shocks from mortgage delinquency and foreclosure may potentially drive child welfare involvement. It found that increases in mortgage delinquency and foreclosure rates are associated with increases in hospital admissions for physical abuse of children under 6 years old and traumatic brain injury for infants under 1. This finding follows what Claire mentioned earlier about the relationship between economic and concrete supports and not only neglect, but also physical abuse. Let's now turn to what the evidence suggests happens when families have increased access to economic and concrete supports. This is a summary of the types of economic and concrete supports that are associated with decreased risk for child welfare involvement based on the research we've compiled. They fall into the following categories: macroeconomic supports, concrete supports, public benefits, and child welfare interventions augmented with economic and concrete supports. I won't be able to talk about all of the studies in each category today, but you can find them in the comprehensive slideshow that's posted on Chapin Hall's website. Let's start with minimum wage. This study looked at child maltreatment reports from 2004 to 2013 and found that states that increased their minimum wage above $7.25 an hour experienced a reduction in child maltreatment reports. It estimated that for every $1 increase in the minimum wage, there was an almost 10% reduction in neglect reports. Aligned with the research I just shared, a state policy option to consider is to establish or increase minimum wage. Because the federal minimum wage hasn't been raised since 2009, several states and localities have raised their own minimum wages. But as the graphic on this slide shows, many states still apply the minimum wage of $7.25 an hour or have no specified minimum wage. In the box on the right, I want to point out that a worker paid the current federal minimum wage earns 40% less than a minimum wage worker in 1968. There's a growing body of evidence showing that the earned income tax credit is associated with decreased risk for child welfare involvement, and in particular, the state level refundable EITC, A refundable EITC means that families can receive a refund even if they don't owe any taxes, but they must file a tax return. This study found that states with a state-level refundable EITC compared to those without had 11% fewer entries into foster care. And it estimated that if states without any EITC implemented a refundable EITC, an average of almost 700 fewer children would enter foster care annually in each state. A state policy option to consider is establishing a state EITC, and in particular, a refundable state EITC. Currently, 26 states, Washington, D.C., Guam, and Puerto Rico have a refundable state EITC. This study looked at the population rate of hospital admissions due to abusive head trauma in California before and after its 2004 paid family leave policy went into effect, compared to 7 states with no paid family leave policy. It found that California's paid family leave policy was associated with a decrease in hospital admissions for abusive head trauma among both children under 1-year-old and children under 2 years old. Only 11 states and Washington, D.C. have adopted a statewide paid family leave program. As a result, less than 1 in 4 workers in the U.S. have access to paid family leave. This recent study looked at states that newly expanded Medicaid in 2014 and found that these states were associated with reductions in the average rate of child neglect reports across all age categories, compared to states that did not expand Medicaid. Researchers suggest that increased household financial stability and improved adult mental health, both of which have been associated with Medicaid expansion, may contribute to a reduction in child welfare involvement. Expanding Medicaid is an important state policy option. Today, we'll see if South Dakota becomes the latest state to vote to expand Medicaid. Go to the next slide. Another state policy option to consider in the Medicaid space are Medicaid waivers that shift to a social determinants of health approach. These waivers provide an important opportunity to use Medicaid funding for non-medical supports related to housing, food, and transportation. This slide highlights the approved Medicaid waivers for North Carolina, California, and Oregon, but several other states have also had similar waivers approved. Shifting to childcare. States with more flexible child care development fund program policies regarding subsidies for child welfare supervised children have, on average, fewer child removals than other states. In this study, more flexible program policies included flexibility around eligibility, priority lists, family co-pays, and activity requirements to qualify for child care subsidies. For mothers who are low income, each additional month they receive a child care subsidy is associated with a 16% decrease in the odds of a neglect report in the following 12 months. New Mexico has prioritized increasing access to child care for its families. It is invested in making child care free for most families over the next year, with the goal of developing a free universal child care system. We'll find out today if New Mexico approves a ballot measure that will make it the first state in the nation to guarantee a constitutional right to early childhood education. If it passes, it will create a dedicated funding stream for universal preschool and childcare, as well as expanded home visiting programs. This randomized controlled trial by our colleagues at Chapin Hall assessed the impact of a supportive housing intervention for child welfare-involved families in Connecticut who faced housing instability. It found that compared to the business-as-usual control group, families who received a housing voucher and case management services experienced fewer removals, lower prevalence of substantiated maltreatment, and increased reunification. Housing stability is a critical issue for many families that become involved in the child welfare system. To address this, Wisconsin is launching a pilot program that will provide short-term housing funds to families with children at risk of removal due to housing insecurity and to families unable to reunify due to inadequate housing. This seminal Paxson study examined the impact of welfare reforms on several measures of child maltreatment. It found that a 10% increase in state public benefit levels for a family of 4, which included TANF and the value of food stamps, is predicted to reduce foster care placements by 8%. States have the option of increasing TANF cash assistance for families. There's been a significant decline in state TANF spending on cash assistance over the last few decades. As you can see from this graphic, today, most states spend only a small percentage of their TANF funds on cash assistance. In fact, 15 states spend less than 10% of their TANF funds on cash assistance. And I want to note that 41% of Black children live in states that spend less than 10% of TANF funds on cash assistance. This longitudinal study tracked children's WIC and SNAP participation, as well as substantiated child maltreatment reports. It found that children from low-income families who participated in SNAP or WIC had a lower risk of experiencing substantiated maltreatment reports compared to children from low-income families who didn't participate in either program. This recent study highlights the important relationship between more generous state SNAP policies and reduced child welfare involvement. It found that states with more generous SNAP policies experienced large reductions in CPS reports, fewer substantiated reports, and fewer foster care placements compared to states with less generous SNAP policies. The study on the previous slide specifically looked at state policy options that increase eligibility and access to SNAP, and you can see those policies listed in the box on the right. The graphic shows that from 2004 to 2016, more states implemented at least one of these generous SNAP policies, but only a handful of states implemented all 4. Let's now turn briefly to family preservation programs. This study found that families with open child welfare cases who received a home-based services program that provided concrete supports are less likely to experience a child maltreatment report compared to families who received the program without any concrete supports. Several states provide concrete supports to families through family preservation programs in an effort to prevent foster care entry. Kentucky's recent state budget included up to $1,000 in flexible funds for families participating in their family preservation program to meet their concrete needs and prevent removal. Now I'm going to pass it back to Claire.
Thanks so much, Yasmin. I'll talk a little bit about the relationship between macroeconomic factors in child welfare involvement, suggesting the need for a population or universal level public health approach to prevention. So we'll talk a little bit about higher income inequality at the county level. It's associated with higher rates of substantiated child maltreatment independent of child poverty rates. And the impact of income inequality on child maltreatment rates is greatest in counties with the highest levels of child poverty. We also know that county spending on prevention services is associated with individual maltreatment investigations. In this study, mothers that were receiving the WIC benefit and they lived in counties with greater amounts of per child spending on prevention services had lower odds of individual child maltreatment investigations compared to those who lived in counties that spend less. Interestingly, the effect of county prevention spending on individual maltreatment investigations is irrespective of the actual receipt of the prevention services. So a macroeconomic or a universal population level spending on prevention services. We see this interesting association. This study, actually randomized controlled trial, provided community-wide nurse home visiting program for families with newborns. It involved 1 to 3 home visits to assess a family's needs with a focus on material needs and to connect them to community resources and provide education and intervention as needed. Families who were assigned to Family Connects and were connected to these resources experienced a 39% fewer CPS investigations through age 5. The findings here suggest that when implemented with high quality and broad reach, a very brief postpartum nurse home visiting program that connects families to resources can reduce population level rates of child maltreatment. Again, a population level consideration, state spending. This analysis found that each additional $1,000 that states spend annually on public benefit programs, as identified in the box on the right, per person living in poverty, is associated with a reduction in child maltreatment reports, substantiated child maltreatment, reduction in foster care, a small reduction in foster care placements, and a 7.7% reduction in child fatalities due to child maltreatment. So, state policy option. We know that state spending in this public benefit package is highly variable. So the level and mix of state spending on public benefits per person living in poverty is a policy option for consideration. So we're going to shift from these sort of macroeconomic considerations to looking at costs and where and how we might think about resourcing and building a child and family well-being system. Where might savings be incurred? We have 2 studies that look at the annual costs of child maltreatment in the US. Direct and indirect costs of child maltreatment estimated at $80 billion. The economic burden due to substantiated child maltreatment in lifetime costs incurred annually estimated a little over $400 billion. An economic burden due to investigated child maltreatment estimated at about $2 trillion. So the amount of resources for downstream post maltreatment or post involvement with child welfare is enormous. We also know that about $33 billion is spent on direct administration of state and local child welfare agencies. And most of that money presently is spent on out-of-home placements and adoption and child protective services, with much smaller percentages on prevention services. And we do anticipate that to increase over time with the Family First Prevention Services Act. And those interventions or those services are centered primarily in mental health, substance abuse, and parenting. And much of what we've looked at here today is evidence of more macroeconomic or public benefit policies that resource families. We also know that when states and as the US spends money on those deeper end foster care services, we have one study showing us a negative return on that investment. Here we see every $1 spent on foster care for a child has an approximate negative social return of about a little over $3.50 to a little over $9.50. And certainly there are human capital and longevity costs of poverty and family instability. This recent study that looked at a 5-decade birth cohort longitudinally compared children who had not experienced early life adversity to children who did experience early life adversity, and children who experienced family instability that includes foster care. This is associated with a 28% higher risk for premature death. and children who experience poverty and crowded housing have an even higher risk of premature death. So we think that it's possible to really reconceptualize family well-being and the prevention of child welfare system involvement by providing or reorienting reorienting our economic and concrete supports as a very explicit and resourced strategy to prevent child maltreatment and involvement with child welfare system. So to prevent families from becoming overloaded, or when they do become overloaded, to deploy our macroeconomic social policies to begin to offload that burden from the family so that they can function as designed. In addition to macroeconomic social policies like a minimum wage, earned income tax credit, child tax credit, including concrete supports for families for whom macroeconomic social policies are not sufficient. This might include healthcare policies, childcare policies. And additionally, some families may need more intensive public benefit policies and human services when macroeconomic policies and concrete support policies are not sufficient. And for families for whom public benefit is not yet helping to reduce volatility, reduce those economic and concrete shocks in their lives, ensuring that something like an economic differential response like we saw in Vermont early in the presentation, or community pathways that many states are beginning to conceptualize and implement as part of their family first plans, can serve as a firewall to prevent child welfare system involvement. We currently orient or place most of our differential response systems inside of child welfare, but conceptually placing it above child welfare so that it is accessible across our human service sector and our public benefit sector, that really can begin to resource families in a prioritized way, in a way that explicitly prevents child welfare system involvement, so that we're using child protection and foster care when it is absolutely needed and required to ensure the safety of children. And we think that this constellation of policies and programmatic approaches can help families make use of services and supports more effectively when they do have specific challenges like substance abuse and mental health that need attention, and to maximize and pair these together so that families can be well and that their children can thrive. Much of our information is provided on our website, and I'm going to turn it back on to Marianne and Brian to close us out.
Great, thanks, Claire. In closing, we hope you'll use this presentation to engage others, to partner with public agencies, to have deep, long conversations with policymakers, and to engage families and communities. Using this evidence should inform both program strategies as well as policy decisions. And of course, we know this has been a long presentation, but we welcome your input and feedback and appreciate your participation.